Why has water fasting become incredibly popular over the last few years?
Well, I think probably on one level it's because it works. It has a major, profound effect on people, both physically as well as psychologically. And I think that people become fed up with the fact that a lot of the traditional approaches to some of the common conditions have been wholly ineffective.
And what are some of the benefits that you found in doing this for so long that can come from water only fasting that would make people hyper interested in giving it a try?
Well, right now, 76% of people are overweight or obese. And along with the extra fat goes visceral fat. Visceral fat's the fat that tends to accumulate around the organs and around the belly. It's hypertrophic, it's hypermetabolic. It acts like a tumor. It's giving off inflammatory products that contribute to conditions like heart disease, diabetes, autoimmune diseases, and cancers like lymphoma. And so you have this epidemic of people developing these conditions. And the traditional approaches are ineffective at helping people, manage those. They give you pills and potions that suppress the symptoms, but don't actually make you live longer or necessarily make you live better. And they guarantee you, if you treat, for example, high blood pressure conventionally, you'll take the pills, and they guarantee you you'll be sick the rest of your life. You'll never get well. You'll be on medications forever. So there's not even any pretense about getting well. It's not part of the paradigm. Whereas with fasting, you get a preferential mobilization of the visceral fat. The inflammation goes down. The visceral fat goes down. The condition begins to reverse. And then if you're willing to do dangerous and radical things like eat well, exercise, and go to bed on time, you can sustain those results. And we've been able to show that. We've done a study with a colleague from the Mayo Clinic looking at blood pressure of 27 people with hypertension. 26 were able to achieve normal blood pressure without medication. And at a year follow-up, 76% had maintained their weight loss, and the majority were still normal blood pressure without medication. So at least highly motivated, self-selected people are capable of making diet and lifestyle changes and sustaining the results that come with fasting.
And I know there's been a lot of different protocols for fasting that have been talked about over the years between intermittent fasting, one meal a day, 12 hours on, 12 hours off. Like, what is it specifically about having zero food in your system? Like, why do you see so many radical changes with that?
Well, there's fasting, which is the complete abstinence of all substances except water in an environment of complete rest, and that can range from a few days to up to 40 days at our facility. And then there's also fasting mimicking programs. Fasting programs designed to try to mimic some of the benefits of fasting without actually having to do fasting. Intermittent feeding, where you're limiting your feeding window. For example, we suggest people not eat 3 to 4 hours before they go to bed at night. So that gives them a 12-hour fast every day just by not eating 3 to 4 hours before dinner. And even that little bit of fasting every day is cumulatively thought to have some potential benefit, not the least of which it helps avoid some of the late night eating, which tends to convert to fat instead of being burned as energy. So there's also the recognition that long-term water fasting needs is much more difficult in the sense that you have to make sure you're a good candidate for fasting through history exam and lab. You got to make sure you rest and hydrate during fasting, and that you refeed carefully, or you can get into trouble. And so for fasting to work well, that is long-term water-only fasting, there's some effort that's taken. With some of the intermittent fasting programs, those can be done safely and effectively without having to go through, the vigorous evaluation, monitoring, and follow-up. And so I think that's the appeal to them. And there's a lot more people doing these intermittent fasting protocols than the long-term water-only fasting that we research at the TrueNorth Health Center.
So as far as differences in metabolic health, losing visceral fat, fighting obesity, things like that, like, what's the effectiveness with water only fasting versus intermittent fasting?
Well, there's a lot of research done by us on long-term water-only fasting. So people they can read our book, Can Fasting Save Your Life? We've summarized it. They can review that literature. There is some literature on intermittent fasting. The people that have done the best work on that include people like Walter Longo, who has a number of studies published as well as a book out there. And you can compare and contrast. But intermittent fasting, modified fasting, these programs are not the same thing as long-term water-only fasting. So the experience that we have with long-term fasting, you don't reproduce that to the same degree when you do the safer, more comfortable, simpler programs, but they're also not quite as impactful as the water-only fasting.
Talk about the importance if someone's going to choose to do a water only fast, of doing it under the care of a licensed medical professional, and how can they do it effectively so that they don't have adverse effects from it?
Well, number one is not everybody's a candidate for water only fasting. So you have to make sure you're a candidate. Number one, if you're on medications, you're not going to fast on medications. So those have to be appropriately weaned. That needs to be done in conjunction with the people that are prescribing the drugs to begin with, or with a doctor that has experience at that. Number two, you're not exercising and going to work when you're water only fasting, you're resting. And the reason is if you're more active, you'll lose more weight, but it won't be fat, it'll be lean tissue. And we're trying to minimize the lean tissue mobilization and maximize the fat, particularly the visceral fat mobilization. And what's interesting in a resting state, like we've published data on this using DEXA scanners, what happens to the body during fasting. And for example, in one study, it happened to be on males, they lost 10% of their total body weight in 14 days of water only fasting, but 20% of their total fat and 40% of their visceral fat. They lost 6% of lean tissue, which was fully recovered at the end of 6 weeks, so that the percentage of their body from lean tissue was actually higher at 6 weeks than it was at baseline. So if you do it right, you can preserve lean tissue, you can maximize fat loss, but that's not what happens if you're running around going to work and trying to do fasting in a non-restful state. During fasting, people have to maintain hydration. Unfortunately, that's not just a question of drinking enough water. If you drink too much water, that can be a problem. Too little can be a problem. It's mostly about not dehydrating by being overly active, getting out in the sun too much, sweating, doing things that would prevent your body from adapting to the fasting state. And most importantly, in recovery is where most people screw it up. They too rapidly return to feeding. And you can get what's called post-fasting edema, where you get some swelling. You can get even refeeding syndrome, theoretically, which could, a disruption of your electrolytes, which could be fatal. And so it's too rapid a recovery to realimentation that's really a major risk. And that unfortunately happens because people feel so good after fasting, they think, oh, well, now they can eat whatever they want and go back into the keto, high fat, high protein type of regimes and stuff. And so we wouldn't recommend that. And that's where fasting gets a little bit more complicated, because people have to take the time to really understand what's going on. That's why we wrote our book, because our book was written not just to inform patients about what they need to know, but to inform their doctors what they need to do to advise them so they don't screw it up.
I like how you brought up that not everyone's a candidate for the water only fast, because I think in the world we live in, where information is easily accessible, somebody will see a clip online about somebody who did a water fast, and then they'll think it's right for them. And then they'll become the person like you just referenced that has these horrific effects after they come off of it, or somebody like I referenced where their energy tanks.
The good news is, though, those people, even if they're not a candidate for, say, water only fasting because they're on some medication or they have complications, there's modifications that they can safely do usually. It might be 600 to 1,200 calories of vegetable-based juice or broths, or it may be one of these programs that are offered by the intermittent fasting folks that they can do safely, that don't require the level of medical monitoring and modification. It's just a little slower. You have to be a little bit more patient. So, but slow and steady sometimes is much better than trying to be a cowboy and do something maybe foolish.
Right. And so there's nothing else other than just water, like no electrolytes, no protein powder, just straight water throughout the day.
Well, fasting is by definition nothing but water with rest. So there's other programs. Yes, there are people that put people on protein powders and do stuff. That's not what my experience is. So I can just talk about what I have experience with. I've done this 25,000 times over the last 40 years at the TrueNorth Health Center. I've really done I'm 66 years old. I haven't done anything all my life except this particular application. And they say that if you're a hammer, everything looks like a nail. And so I have a bias towards fasting because that's what I do, that's what I see work. That doesn't mean other things don't work, but I'm just not the person to be able to advise you about those other things.
Right. And when it comes to fasting, you've worked with people that have done it for up to 40 days. I think like somebody listening to this or watching this is like, well, wouldn't that person die? Wouldn't they die of starvation? Like, how is that? How is that possible?
Actually, interestingly enough, an average 70-kilogram male could fast probably 70 days. We don't think you should do that. We don't do that in our facility. We only fast up to 40 days. When you keep the fast shorter, well, what we call shorter, that you don't run into the complications that you get into the much longer fast. I remember the guy I was studying with in Australia when I went to osteopathic college used to do fast 60, 70 days, in one case up to 100 days. And I asked him when I got there, how come you're not doing the longer fast now, only 40 days or less? And he said, oh, because of the sleep deprivation. And I said, oh, do the patients have trouble sleeping after 40 days? He said, not the patients, me. And it turns out it's just a little more complicated as you get really deep into the fast. So we keep it 40 days or less. And in fact, most of our patients are not fasting 40 days. The majority of our patients are fasting somewhere between 2 and 4 weeks. And so, it's really 14 days or 20 days, depending on the condition, the patient, and how they respond to fasting. You don't know exactly how long to fast until you see how the body responds to the fasting process itself.
So let's just say somebody comes in and does this. You wrote a book about how fasting can save your life. Like, what types of results can somebody expect when it comes to their metabolic health, losing visceral fat, their energy and stuff after doing a fast?
Well, they're going to lose a pound a day on average. So, person fasts 3 weeks, they're going to lose about 21 pounds. And by the time they do follow up, the majority of their net weight loss is going to be fat and visceral fat because they'll recover their muscle, as they re-element after fasting. When we do fasting, we have people seen twice a day by our staff doctors in our facility. We monitor their hydration, their blood levels, etc. We do a lot of education too when they're there, so that when they go home, they know the diet and lifestyle changes they want to make, so they sustain the results. And then, of course, after fasting, we reintroduce exercise and flexibility and stretching and all that type of stuff. And for people that are willing to take the time to do it right, it is absolutely can be done safely, and it can be effective for people with conditions that respond to fasting.
And I would love to hear like the time frame of what people can expect, if they were to do a fast for say 1 day, 2 day, 3 day, and then how does the results and what they feel progress up until, that 2 to 4 week period.
Yeah, so as they get into fasting, initially their mouth sometimes coats up and tastes like something crawled in there and died. They may have some headache initially, especially if they're withdrawing caffeine or other drugs. They may have some low back pain as the kidneys are working really hard, and they may cause a little bit of referral pain into the low back. They may have skin rashes and discharges because the body's going through some heavy detox. They may have some foul odors emanating from the body. It can be really what I consider quite entertaining, but not always considered pleasant by patients going through it. But eventually they get through these detox and healing crisis type problems and usually reach a period of stability. Once we reach stability, then the question is if the conditions are resolved, and we'll move back into refeeding. Sometimes that's a few days, sometimes it's a few weeks, sometimes it'll take several fasts to get people well because they're really buried in deep. But for example, a person with high blood pressure, a typical patient coming in 160 over 100, maybe we wean them off their meds. It'll take 2 to 3 weeks. They'll have normal blood pressure. If they maintain the diet, they'll maintain their pressure. We have the largest effects ever shown in treating high blood pressure in humans. We did a study with 174 consecutive patients. 174 people lowered their pressure enough to eliminate the need for medication. So it's very likely if you have high blood pressure that's not complicated by some weird kidney disease or something else, that you can end up with normal blood pressure and eliminate the need for medications to the degree you're willing to do the diet and exercise program that follows fasting.
What about losing lean mass? You'll hear a lot of people say that when you're trying to lose body fat, you got to keep protein at a certain level to prevent losing lean muscle tissue. What have your results proven?
Well, yeah, we've shown that, as I said, 10% fat, 20% of, 10% of total body weight, 20% of fat, 40% of visceral fat, 6% of lean tissue. But that lean tissue recovers within 6 weeks, so that overall there's no net loss of lean tissue. What there is a progressive loss of fat, and particularly visceral fat. So the body's breaking down this visceral fat just like it does a tumor. If you go on a fast and you lose 10% of your body weight, you don't necessarily lose 10% of your breast tumor. You may lose 50% of your breast tumor or 100% of the tumor, because the body's breaking tissues down in inverse proportion to their need. It's not like, it does what you or I want it to do. It does what it thinks is the most critical for its net survival.
I've been in recovery for it'll be 17 years in October, and I think that what can happen during like the withdrawal process from drugs, you have all kinds of symptoms and side effects that have to be dealt with at times. What are some of the things that you've seen your patients where you have to kind of deal with certain things that pop up as they're progressing through this
Yeah,
fast.
it can be very intense. It's very similar to withdrawal that people go through with alcohol and drugs, in the sense that it varies from person to person. Some people it's easy, some people it's hard. Hard to predict what's going to happen for any given individual. But what we have found is if people are willing to prepare properly before fasting, by eating fruits and vegetables and avoiding animal foods, coffee, alcohol, etc., the transition to fasting is dramatically easier. And no, so now our patients are having a much easier time than they did 20, 30, 40 years ago, when we didn't do a lot of encouragement about preparation for fasting. We just brought them in and got to it. Now we'll have them do a little bit of wean down, and that wean down really does help make the experience much better. Just like it's easier to withdraw from a small drug habit than it is a huge drug habit. The more you're on, the longer you take, and the harder it's going to be.
And it seems like this is kind of like a medical intervention that you're talking about, where people come into your clinic and they do it in a very supervised way. I'm seeing people do these water fasts on their own at times, once a month, once every other month, sometimes multiple times a month. Is this something that you think people should do?
Yes, I think people should fast every day for between 12 and 16 hours, depending on if they're trying to gain weight, lose weight, whatever. So they should not eat 3 to 4 hours before you go to bed. If they're trying to lose weight, they might even delay breakfast till they've had a chance to do some exercise in the morning, preferentially mobilizing fat. If they're trying to gain weight, then it's probably going to be a 12-hour feeding window, because you need more time with this high nutrient density, low caloric density food to get enough total calories in. So for kids and people trying to gain weight, we have a 12-hour feeding window. For people trying to lose weight, we have an 8-hour feeding window.
I meant like I'm seeing people do like consecutive day fasting, like multiple times a month sometimes. Like, do you think that that's the way to do it?
Biologically, the most expensive part of fasting, where you burn the most lean tissue, is really that first 72 hours. And so if you're spending a lot of time in that range, you're going to have disproportionately more lean tissue stress than if you just do the 12 to 16 hours where you still have glycogen stores, and then occasionally do the longer fast where you only have a brief window in that protein depleting phase and get the detox phase, which comes later in fasting. So I think it's more efficient to do it the way we recommend it and the way we describe it in our book, Can Fasting Save Your Life? But other people have different opinions, and that's good, because if everybody else was right, there'd be no need for us. So I'm glad that other people are mistaken.
What other mistakes do you see people make when they're trying to fast?
Biggest thing is being too active. That's where people get into the most trouble, and they end up with dehydration, and it gets to be a mess, or too rapid refeeding after fasting. The most critical mistake, though, is a person fasting that shouldn't be fasting, or continuing to fast on medications. Medications can be potentiated in fasting. A drug you might get away with in a feeding state, you may not get away with in a fasting state. And so people are burning holes in their stomach and you're creating all kinds of problems unnecessarily just because they're ignorant. That's why we wrote the book, so they could make more intelligent decisions about their fasting, whether it's at home or whether it's at a place like TrueNorth Health Center. Now, we do provide support for people that are fasting remotely, but we do it in conjunction with their local doctor. So we'll work with the patient and their local doctor. So the doctor would do the exam and lab. We can provide remote support to guide them through the fasting process, but they have a physician available should untoward symptoms arise, and they don't end up in trouble that way.
The common theme I'm hearing you share is that medical supervision is super important for people who are going to do these extended fasts, right?
Yeah, especially it's true for people that have health concerns or conditions that are on medications. They can really make a mess of things. So it is a safe biological adaptation, but you still want to do it intelligently. And unfortunately, people are so out of touch with what intelligent, healthful living is that for many people, they think they're doing the right thing, when in actuality, they're compromising their health every single day.
There's a lot of people that struggle with looking at the way they see themselves in the mirror, body dysmorphia, disordered eating patterns. How do you screen for that when people are coming in to do fasts?
Well, the thing is, there are some conditions like anorexia nervosa that are not responsive to fasting. People want to fast, but it's not good for them. We don't do, what we do is we offer a free service. We have people go to our website at TrueNorthHealth.com. They fill out the registration forms. I review their medical history with them in a no-cost phone conversation to make sure, number one, is this something they should be thinking about, and to try to point them in the right direction, whether it's to come to a place like TrueNorth Health, to do it at home in conjunction with their doctor and support, or maybe they need to do something else that would be safer, more effective, that doesn't require them to have medical supervision. But it might be slower, but would be a better option for them.
Yeah, because I think that outside of the medication piece, where you're saying people who aren't good candidates for fasting are people that want to do it just to lose like the extra couple pounds, and maybe they might be already too much on the leaner side. I mean, we're seeing that now with Ozempic. I'm a fan of Ozempic, but I'm not necessarily. I don't think it's necessarily like the right thing to do for somebody who just wants to lose like 3 to 5 pounds.
Well, I have some concerns about the GLP inhibitors because, I mean, for one thing, if you look at the data, a lot of people are having, by 3 months, a lot of people are winding up because of the nausea, the uh, problems with, metabolic implications. So there's a lot of side effects that come in over time. Now, it's true that being overweight is so dangerous. Even taking a drug that helps you lose weight by making you nauseous and not want to eat as much of your standard diet might have some short-term net benefit, but what would be better is to naturally stimulate GLP inhibitors through diet and exercise, getting people to eat whole food diets, exercising. They also lose weight. Males lose 3 pounds a week on average, females 2 pounds a week, down to optimum weight. Now, granted, it's more difficult because you have to give up the greasy, fatty, processed, ultra-processed foods that people are addicted to. But a better solution in my mind for weight loss is to make the diet and lifestyle changes rather than to manipulate our physiology with drugs that have some long-term consequences.
And I definitely want to get into the diet and lifestyle changes that people must make if they want to be the healthiest they possibly can be. But first, there's a lot of talk about visceral fat. And I think over the years, fat has just been something that people have looked at as far as vanity and what you can see on the outside. But I've heard you talk about that obviously visceral fat is much more than that, as much more than that. Talk about like the difference between like visceral fat versus fat you might see like on the outside and why it's so dangerous.
Well, adipose tissue is normal food storage, and too much of it's not a good thing. But the most dangerous type of fat is called visceral fat. It makes up about 10% of fat. It's usually the fat around the belly and in the organs. And as I said, it's hypertrophic, it's hypermetabolic. It's really like having a tumor. So sometimes people have 2, 3, 4 pounds of visceral fat. That's like having a 2, 3, 4 pound tumor. It shouldn't really be there, but in a world of our ancestors, in a world of scarcity, storing fat was so valuable that if there was a rare opportunity to get extra to eat, the people that stored the fat lived to reproduce and were programmed that way. Now, in the world of excess, in the modern world, it's possible to get excess all the time, and the excess visceral fat is actually killing us. And so, getting rid of that visceral fat is important. You can do it with diet and exercise. You can do it preferentially with fasting. And that's really the one justification for fasting in relation to weight, is that it actively goes in there specifically and is mobilizing this tumor-like visceral fat material. And that's why you see people with blood pressure, diabetes, inflammatory conditions, autoimmune diseases responding very quickly to fasting. Because these patients are being medicated not for their diagnosis, they're being medicated for the diet that's making them fat, sick, and miserable. When you change the diet, you change the need for medication. When you fast, it just happens rapidly. So if you're patient, you can do it with diet and exercise alone. If you want to see that process sped up, definitely fasting may be a useful tool.
So besides fasting, with regards to eliminating visceral fat, what are some of the specific like food choices people should be making?
Well, we advocate that people eat whole foods. So things like whole fruits, not juices and dried fruits and processed foods and sugars and date sugars and all that stuff. Not refined carbohydrates, so not the white flours, the sucrose, the white sugars, etc. We suggest that people get their fats, their essential fatty acids, from whole food. So fruits and vegetables again, and some foods like avocados, nuts, and seeds tend to be really concentrated. So you want to be careful about quantitative. You don't want to eat those necessarily foods without some restraint. We want to see the majority of calories. You're looking at about 10% of calories from protein, about 15 to 18% of calories from fat, and about 70% from complex carbohydrates. So whole plant food carbohydrates, potatoes, rice, beans, not the flour products, not the processed, ultra processed foods with the emulsifiers and all the chemicals added to it. So, an exclusively whole plant food diet that's SOS free. SOS is the international symbol of danger, but it stands for the chemicals added to food that make people fat, sick, and miserable. And those include salt, oil, and sugar. You get all the essential fats you need from a variety of whole plant foods. You get all the carbohydrates you need without eating sugars. And you actually get all the sodium you need from a variety of whole plant foods. You don't need to be adding these highly processed white powders to your food in order to be able to get your nutrients met.
So are you in the anti-seed oil camp as well then too?
Yeah, I don't recommend any oils actually, except the fats naturally occurring in whole plant foods. But again, these diets are not low fat in the sense that they're 15 to 18% of calories from fat. It's just entirely derived from whole foods. And they're not low protein. They're 10% of calories from protein, but it's the proteins found in whole foods, not protein powders and fractionated foods and not from animal products.
So do you think that somebody can do it effectively if they want to, let's just say, be, um, an omnivore and eat some animal protein? Is there certain things you would recommend to maximize the benefit?
Well, there's no question people can eat animal foods and be healthy. Lots of, I mean, animal foods as a whole, if we're talking about meat, fish, this kind of thing, these are whole foods. It's just that unfortunately now animal foods have some challenges because of the world we live in terms of biologically concentrated a lot of toxins, the antibiotics and pesticides and other things that are used in conjunction with food. So if you look at a calorie of animal food, even healthy animal food, you're going to have 2 to 1,000 times the concentration of some of these products that you would say from a calorie of plant foods. So in our approach, we use an exclusively plant food diet. If you're going to use animal foods, I'd recommend that you try to stick to the animal foods that have lower concentrations of these materials, and also keep the calories as low as possible. The less you eat, probably the healthier you live, the longer you're likely to live.
And you're there, you'll hear a lot of people say that you can get the same benefits you get from fasting by just eating less on a consistent basis and restricting your calories over time. Like, what are your thoughts on that argument? And then what is your kind of rebuttal to promote or prove that
I would
fasting?
agree for weight loss and for most problems, if you eat a good diet, exercise, and sleep, that's the answer. That's certainly, whether you fast or not, what you're going to need to do to maintain the results. Fasting doesn't cure anything. Like, you can't cure obesity. You can lose the weight and keep it off. But if you go back to eating the things that caused you to be fat, you're getting fat again. You can normalize blood pressure. I've had people on normal blood pressure with, for 30 years. But if they get back to eating the salty, fatty, processed foods, it would come back. They're not cured, they're managed. We're managing conditions with healthy living rather than pills and potions. So I agree completely with people who say the key is diet, sleep, and exercise. But if you have lymphoma, if you have high blood pressure, if you have diabetes, you may find that it's very difficult to make the necessary changes and get changes quick enough to eliminate the need for medications. With diet alone, fasting can speed things up. And for some people, they want to eat healthy, but they can't do it. They're having trouble doing it because they're addicts. They're addicted to the artificial stimulation of dopamine, the neurochemical in the brain associated with pleasure, from their drugs, their smoking, their drinking, or their diet. And so for them, it's a way of breaking that addictive cycle of escaping the pleasure trap. So it can be very helpful for those people. Now, they still have to do the diet and lifestyle, but to get to where the food tastes good, where they're out of pain, they can get off the drugs, fasting can be a great facilitator.
And I've heard people more recently say that they want to fast to get the autophagy benefits. And I know that autophagy can be stimulated through other things like exercise and stuff like that. But how does autophagy in your experience differ between fasting and exercise?
Well, it's true. Autophagy. In fact, Yoshinori Ishimi won the Nobel Prize for Medicine in 2016, talking about how this is the way the body gets rid of cancer cells and gets rid of senescent cells and the breakdown products and gets rid of the inflammation. And it turns out that fasting accentuates it, which is, you take rats and you periodically fast and you double their lifespan. It's amazing the changes that you can induce. It's also true you can do it with intermittent calorie restriction. You can also, they've done all kinds of studies in rats with, feed rats 40% of ad libitum intake and they live 30% longer and all that kind of stuff. It's also true that exercise induces increased autophagy as well. In fact, if you look at all the benefits of exercise, all the cardiometabolic changes that occur with exercise, they also often occur with fasting. And you might wonder, why would that be? Fasting, you're resting, exercise, you're vigorous. Why would they do the same thing metabolically? And it may be because both fasting and exercise have something in common. They both get rid of the consequence of dietary excess, the fat and the visceral fat. So people that are exercising regularly get a lot of benefits. People that are fasting get benefits. Goodness, if you do both, both, not at the same time, but if you incorporate both of them into your lifestyle where you're eating well, you're exercising, you're fasting every day for 12 to 16 hours, and maybe occasionally for a longer period of time, we believe not only will people live to their full potential, but they can avoid the last 20 years of debility that so many people experience, and not just increasing life expectancy, but healthy lifespan. And actually, I think that's where the best benefit comes, is healthy people doing shorter periods of time preventatively so that they end up living their full life potential instead of finding themselves unable to talk or move, lying in some nursing home bed after they've had an unnecessary stroke or heart attack. But instead living till they go to sleep one night and don't wake up because they've reached their genetic potential. A good life and then a good death. I think diet, exercise, and fasting can all be helpful in achieving that goal.
What's been the most surprising benefit you've seen from fasting that may shock people?
This episode is brought to you by Live On Labs. If you are someone who is constantly stressed, feeling depleted, and exhausted, I have some exciting news. My friends at Live On Labs have an incredible deal I can offer you. When you buy any product at full price, you get a free carton of their highly popular B complex product, which I take every day. Taking a B complex supplement can also help support things like a healthy metabolism, increased energy, blood sugar balance, and learning. Vitamin B supplements can help replenish nutrients depleted from stress. Live On Labs puts years of research into each product, which is why I stand behind them. Using liposome encapsulation technology, these products promote elite absorption so the supplements get into your cells and give you the best benefits that you're looking for. Right now, you can get a free carton of Lipospheric B Complex Plus, which is a $56 value with any full price purchase from liveonlabs.com. This supplement has the B vitamins and minerals that you need to help turn food into sustained natural energy throughout the day. Just add B Complex Plus and any other full price supplement to your cart and enter code BOPES24 at checkout to get this amazing deal. Now back to the show.
I was just shocked recently. We published 2 papers now on this, on the issue of lipoprotein(a). Lipoprotein(a) was thought to be a genetic marker for cardiovascular risk. The higher your lipoprotein A, the more likely you are to get cardiovascular disease. In fact, Medicare will only pay for you to test for it one time. Because if it's elevated, well, tough luck, but there's nothing we can do about it. There's no drug that lowers it. And diet alone, like a vegetarian diet, helps with lipids and other things, but it doesn't seem to have an effect on lipoprotein(a). And when we took some vegetarians that were already eating healthy, but had elevated lipid levels, including lipoprotein(a), and we fasted them, it turned out we were getting 40%, 33% reductions with even short fast, 5 days, 10 days. And we've published some of those papers and we're collecting more data now. And it turns out we don't know the mechanism yet, but fasting consistently is reducing lipoprotein(a), even though currently there are no drugs that have been approved to do that. There is one drug in the chute right now, but of course it's going to have inevitably a lot of side effects and other things like most drugs do. Right now, there's a lot of interest from pharmaceutical companies to try to come up with what are called fasting mimicking drugs, which is drugs that you can take and they can sell that will do to your body what fasting does, but without having to do the fasting and in a form that they can make some money on.
Have you seen anybody come out of this with some mental and emotional benefits as well, other than just the physical stuff we've been talking about?
Yeah. There's a very interesting book out called Anatomy of an Epidemic, and it talks about how our current management for depression and anxiety with serotonin uptake inhibitor medications is creating an epidemic of debility. And we spend a lot of time people getting off those medications and then fasting them. And it's been very gratifying to see that many of these patients are able to function better off medications than they ever did on medications. Unfortunately, even if you do well fasting, you still have to do the diet, sleep, and exercise to sustain the long-term benefit. It's just like treating obesity, heart disease, diabetes, lymphoma. It's not fasting and then you're done. It's fasting as a way of instituting and maintaining a healthy diet and lifestyle. Health results from healthful living. I don't know of any shortcut to that.
And when it comes to diet and lifestyle changes, you've talked about the nutrition protocol that you recommend for people. What does that transition period look like? Walk me through the day they leave your office and then to implementing these changes that they need to do on their own. What does that look like?
Well, if they have a 3-week fast, they're going to have 2 or 3 days of juices and then 2 or 3 days of raw fruits and vegetables. And then we're going to introduce steamed and starchy vegetables and then nuts and seeds and legumes. So by the time they're done, they're on an exclusively whole plant food SOS-free diet. It'll take half the length of the fast to get there. So a 20-day fast, it'll take about 10 days of progressive refeeding. Then once they do that, we ask them to stick to a whole plant food SOS-free diet, get their sleep, get their exercise, and also we try to help them learn how to mitigate stress. Because it turns out when you're constantly under too much stress, that stimulates hormones and other things that are not so good for you. And that's challenging in a world that we live in right now because there's lots of chances for stress and not so many opportunities to dissipate it. So we try to get people, for example, maybe they need to ration how much news they watch. You know, you don't need to watch the news every day in order to be a fully informed citizen. And sometimes that can be really stressful. It means sometimes making choices about who they're interacting with. A lot of people spend a lot of time with what I call energy vampires, people that do what they do best, and that's make other people as sick and miserable as they are so they don't have to feel so bad by comparison. And so maybe they got to kick some of those people to the curb and cultivate relationships with people that are more health conscious and more supportive of their attempt to be health conscious. My mom, when she was 92, she realized she'd outlived all of her friends. All of her friends were dead. And it was getting harder and harder to make new friends because even people 10 years younger were too old and they were too busy with their drugs and pills and sickness. And so she said, Alan, you have to warn your patients. If they're going to eat like this, they need to make younger friends or pick a couple friends that are health conscious so there'll be people that are left at the end. And the truth is, people that live healthy tend to live longer, better lives. But it doesn't mean that it's easy socially if the people they've been hanging out with are not health conscious.
You bring up such an interesting point, which I think makes fasting harder for people if they're not in a confined, medically supervised environment, and that is stress. Like you can do all the lifestyle things in the world, but if you're coming home and your house is chaotic and stressful, like none of this stuff is going to fix that. And so I'm really glad that you brought that up.
We don't know, but some of our benefits that we see in our studies may be fasting. Some of it may be because people are put into an emotionally supportive environment and, they're getting to rest and they're getting to take care of business. We don't know how much of the part is physical, how much is psychological, how much of it's spiritual. There's a reason why the Jews and the Jains and the Hindus and the Muslims, the Buddhists and the Christians, who, by the way, don't get along on everything, but they all have a tradition about fasting. Fasting changes the way you see yourself and the world around you. We are not coming from you don't have a specific spiritual path that we advocate or something like that. We're really just doctors doing healthcare. But we recognize that it does seem to have a profound effect on people's, emotional and spiritual factors. In fact, some of our people, that's what's driving them to want to fast, is they're looking specifically to activate those mechanisms that seem to come up when you rest and you give your body a chance to heal itself.
Yeah, I wonder how you could like test that. Like, could you medically supervise a fast within someone's home versus at your clinic to see?
We're doing a study right now on that very thing. What we're doing is we're offering remote fasting supervision in conjunction with people's local doctors. And, for people that are good candidates for that don't have complicated situations that require heavier monitoring like we do at TrueNorth Health. And we're going to find out how to do it safely, what the results are. We're doing a safety study looking at that very issue. What I can tell you already, though, is it's really hard for people to fast at home because they've got kids and teenagers and emergencies that come up. They've got pressures and stresses, and the very addictions that led them into needing to fast oftentimes are activated. And if they're in a supportive environment, the chances are better. It's just like with alcoholics. Some alcoholics can quit on their own, but many need to go to a place and be there for a while to be successful. And some need to do it for a week, some need to do it for 30 days, some need to do it for 90 days, some need to do it a few times. So we have to be a little bit individual in terms of our recommendations about what really makes sense for that person. That's why we offer that service of screening for people, so we can kind of guide them based on our experience of what program might make sense for them. I really don't care what people do as long as they're successful and we get a good long-term result. I'm not care if they're at home, if they're at the center, if they're able to do it with diet and lifestyle alone, that's okay. My goal is to show that people can get healthy. Right now, that's not known. Many of the doctors that train with us in our residency program, they see these people and they say, oh my God, I've never seen people get well before. They've never had a patient with hypertension or diabetes get well because that's not part of the medical paradigm. It's about getting people on drugs and keeping them there for the rest of their life.
I'm really interested to learn about the study you're doing with the remote patients versus the in-house patients, because from an emotional level, because I got into recovery when I was in jail, and obviously there's not many benefits to going to jail. But one of the things that you'll hear is that people have a hard time adjusting when they get out because they've been taken care of, inside of that facility where they don't have the necessary, they don't have the responsibilities they had before. They're kind of protected and confined. Um, and I say that just to say, like, I wonder, what it's like when people transition out of your clinic. Like, is there like do you hear feedback from people about like stress, anxiety and stuff, like when they're actually leaving your clinic and going back into real life?
It is a real problem because you're in a protective environment, you're feeling great, you go home and it turns out everybody's not supportive. Some people are really destructive and counterproductive. We warn people about it so they can be careful about how they associate. When people recover from alcohol, you don't tell them, well, you should become a bartender now. That's the best job for you. Go in and work as a bartender first thing. Now, I have recovered alcoholic patients who are doing fine working as bartenders, but that's not the first job that you try to push them into. They have to have a high degree of stability and sobriety before they're going to be able to be in that environment and not find it, exhausting mentally and emotionally. And it's interesting too in recovery, that made me think of something. The danger usually isn't when they're first into recovery. It's after they decide they're better and that they could drink normally, that they could regulate their drug use like other people that are not addicts. And they find out pretty quickly that that's probably not real. A little bit becomes a lot real quickly. And so the same thing's true with diet is, when you first are enthusiastic, you're doing the diet, you think, well, I could have a little of this and I can have a little of that. And, oftentimes that's not really the best strategy for success. And so like many alcoholics realize they have to not drink at all. Many people that are struggling with these dietary issues find they're a lot better off not teasing their nervous system with the oil, the sugar, the salt, and they're better off just eating their fill of whole foods and trying to stay away from the temptation. But that's harder to do today because at least if you're an alcoholic, somebody might say, oh, have a drink. And they say, well, I'm recovering. And they might give you permission to not do it without giving you help. But if you're on trying to make dietary changes, they're going to be telling you, oh, it's not good to be a fanatic. Where are you going to get your protein from? A little bit won't hurt. My doctor says eating that stuff is really good. And they'll give you nothing but trouble about it.
Yeah, I've learned in my career and years of doing this that the people that are giving you crap for making healthy lifestyle changes are typically the people that need to do it themselves, right? And I think that's an important reminder because it can be hard when you hear specifically comes from the people that love you most. Sometimes saying this stuff to you, it can be hard to like hear it sometimes.
Yeah. What I tell patients is that your friends don't all have to eat well and live healthy. They just have to tolerate you doing it. It's just like if you're a recovered drunk, you don't need every one of your friends to be sober. You just need your friends to respect the fact that you're dealing with a difficult issue for you and to be respectful of you and not give you a hard time about it. And that doesn't mean they have to do what you're doing in order for you to be able to associate with them. But they do have to respect you and care about you enough to not undermine your success.
Let's talk habit formation because I'm just, listening to this and hearing you, share what you do in the clinic. And I imagine people are coming to you because they've mismanaged their habits with their lifestyle. And they come into your clinic and they have this, profound medical intervention that essentially revamps their body, their metabolic health, and they're leaving. And maybe their brain hasn't changed enough to where now they've got habits in place where they can do this successfully and be consistent. Like, how do you help people make that transition from being habitually unhealthy? They come in to your clinic for a month or two, and then now they got to go back into the real world and make healthy choices.
Yeah, this is actually the real issue. I think you've identified what because we can get them well. If we pick the right people, they get well. But they go home. Now, in a normal research facility, the rodents don't ever leave. You have them in contained environments forever. I would love to be able to do that. I'd get great long-term outcome data. But in our situation, humans insist on going back to free living. And so we have those challenges. One way we do it is we offer ongoing educational support. We live stream our lectures and whatnot so they can tune in anytime. We have telemedicine support from our doctors so they're able to access a doctor who's not an idiot that's able to provide them support. We try to give them the skills when they're there, and we keep them refeeding for a period of half the length of the fast. So they've had a good chance to establish behavior patterns. before they go home. So we're doing what we can do there, and we're researching how we can maybe do it better. But the real reality is people are going back to a world designed to make them fat, sick, and miserable. And it's going to be the most difficult thing they ever do in their life is to overcoming those challenges. It's really hard. Fortunately, our patients are often motivated by pain, debility, and fear of death. And that seems to be motivating. What we're trying to do is get to more people early before they fall apart, because it turns out those people don't have to fast so long. They're a lot easier to manage. And prevention is a lot cheaper and a lot better than treatment. But getting attention of people before they're driven by pain, debility, and fear of death is a great challenge. Maybe you can help me figure out how to do that.
What's the biggest thing people need help with when they're coming to you? Is it the fear of death? Is it that they're metabolically unhealthy? Is it that their energy's tanked? Like, what's the common pain point?
Well, I think the biggest problem is they don't know if it's true that they can get well, because they've been told there's no hope, it's hopeless, nothing can be done, diet doesn't matter, nobody gets well, because that's the experience of the doctors they're working with. Many of those doctors will tell you they've never had a patient of diabetes or whatever it is get well. They don't even think about that. It's not even part of the discussion or the paradigm. It's how to manage the disease with which drug or surgery, and how to move 26 patient contacts a day through the system and still get out of there on time. They're not getting a chance to see what we're seeing, where people are able to make these changes and get well. So I think the first thing is the idea that getting well is possible. That's number one. Number two, having realistic expectations. If you're 50 pounds overweight, you don't lose 50 pounds in a week, unless you have, bypass surgery or something and cut your leg off at the hip or something. So if you know that weight loss is 2 pounds a week, then your expectations are not going to be violated to the negative, in terms of dietary weight loss, or that weight loss is a pound a day fasting. You know what your expectations are. We don't want people's expectations violated to the negative. We want it violated to the positive. We want them coming in with realistic expectations, and that they're able to achieve the goals within the kind of time frame that we think is possible. Or if we don't know, we're certainly frank to tell them that we don't know. It's an experiment. We'll see what happens. The second thing is, socially, they think their friends are all going to be happy and supportive, but it turns out not always the case. And I know women have told me sometimes they'll lose 50 pounds and go back to work, and the other women are not supportive at all. It's like, oh, here she comes, and they're actively undermining their success. Men, not quite as much problem, because the other men, if a guy goes back to work and loses 50 pounds, the other guys don't even notice. And if they do notice, they don't really care. So it's, I think, easier for males sometimes than females, because there's a different psychology that goes along between male interactions and female interactions. At least that's my generalized observation. So I think if you're a woman, I think it's harder. Metabolically, women lose about 50% weight less at about 50% less rate. Average male is about 3 pounds a week. Average female is about 2 pounds a week. Women are they're full of estrogen, which is a fat storage hormone. Men are full of testosterone. So, I think it's easier on men than it is on women when it comes to some of these issues, psychologically as well as physiologically.
What's the exercise protocol you recommend for people?
Well, when they're fasting, we're limiting their aerobic exercise. So we do a little yoga, a little stretching, but it's very passive. Once they come off, though, walking, hiking, biking, swimming, dancing, I like to see people doing a variety of things instead of, like, I personally just play basketball. I wouldn't recommend that. I love basketball. I play basketball 5 times a week. I can't see spending time doing something less fun than that. So that's what I do. But what's better from a health standpoint is getting people to do a little of this, a little of that, aerobic, stretching, strengthening, a variety of materials. You don't get overuse injuries as much. It's probably better for your overall health. But whatever you do, you've got to engage in regular, vigorous activity, strength, balance, stretching, as well as aerobics. And sleep, critical activity, one of our most important activities. You should be able to go to sleep, wake up feeling refreshed. It might be 6, might be 7, might be 8 hours. Depends on you, your age, your stress levels. But you've got to get plenty of sleep. You shouldn't be using an addictive drug like caffeine in order to stimulate yourself so you can function. If you have to take coffee, you're not getting the quality and quantity of sleep you need. And then again, we talked about, trying to have some positive emotional aspects in your life where you're interacting with people that are supportive instead of, destructive, and maybe not spend so much time on, indulging in the miseries of everybody through the news and a lot of the media type stuff. And even some of the recreational activities, some of these, video games and things that aren't particularly health promoting or supportive may not be something you want to spend inordinate amounts of time doing, and particularly your kids.
What about strength training?
I think strength training is critical. But again, whether it be whole body activities, the yoga, the Pilates, resistance training, I would advise people if they're going to do resistance training, don't get macho about it. You know, high rep, excellent form, and don't get into repetitive injuries. As a chiropractor, I see a lot of people that have injured themselves, well intentioned, but trying to get a little too macho, trying to do a little too much too fast. That's why I like the walking, hiking, biking, swimming, whole body activities, especially as you get fit. Certainly, weight training can be a very useful tool for building muscle mass and bone strength. But again, it needs to be done right. It's not something you want to go out and be macho about or be casual about. Get some good instruction in using the equipment appropriately so that you don't hurt yourself in the process of trying to get well.
And what about sleep? Like you've talked about, if people could just eat well, exercise, and sleep well, they'll be great. Like, what is the optimal protocol for
There's
sleeping?
some tricks to sleep in my experience. Cool, dark, and quiet place. Try to set a consistent pattern. Get to bed earlier. Don't try to pretend that you're going to be able to sleep later consistently. So you're going to have everybody has a little different biorhythm in there. The idea is to get to bed early enough that when you wake up, you feel refreshed, however much time that needs to be. That you're not eating 3 to 4 hours before you go to bed, so you don't have to wake up to pee all the time at night. There's not going to have disruption there. Don't be having animals jumping on your bed and waking you up at all hours of the night. Try to minimize the noise. Sometimes that's a trouble if you live in the city and you got gunfire over your roof or whatever. That can be disturbing. But you try to do the best you can to create a cool, dark, and quiet place. Consistent time to bed. Don't compromise your sleep quality in the sense that make sure you always allocate adequate time for sleep. And if you do that and you prioritize sleep, sleep becomes a really good friend and advocate rather than a deficit.
When it comes to other like longevity practices, is there anything else that you would recommend that could really like move the needle for people who are trying to live longer, lose visceral fat, and feel better about themselves?
Well, I see fasting as so useful because it affects everything. When you have constant pain and you go on a fast to get out of pain, now you sleep better. And now you can exercise. And now, so it has all these downstream benefits. It's not just the fasting, it's getting rid of the problem. The biggest thing is controlling what you put in your mouth, in my experience. That's probably as much as 80% of the effect size. And what I advocate is an exclusively whole plant food diet that's free of salt, oil, and sugar. I know just people disagree with me on that. That's fine. But if you're struggling, give it a try. See how you feel. Going back to eating the diet we're designed to eat. And if it doesn't work for you, you can always go back to that Dr. Atkins diet or whatever else it is that's popular that week.
Is Atkins still a thing?
I don't know. There are a lot of versions of this. High protein, high fat. Kind of versions that may result in some short-term benefit, but not necessarily long-term health. My concern for my patients isn't just the short term. It's also, I want the last 20 years of their life to be the best years of their life and try to avoid all that debility. And the way you do that, in my experience, is a whole plant food, SOS-free diet, sleep, and exercise. And I've got the patients to prove it because I've been practicing for 40 years, and I've got people I've been following for 40 years, and they're in their 80s right now, and they say the same thing over and over again. Everybody they know is dead, in many cases, including some of their kids that have aged out because they weren't willing to follow their parents' lead on adopting a whole plant food diet.
Well, what's interesting to me is a lot of times the keto and carnivore community fasting goes hand in hand with the way they live their life. Like, how do you feel about that? Can the fasting offset some of these negative?
Well, what they're trying to do is they're using the keto diet to mimic some of the benefits we see with fasting, the hunger blunting, the reduced inflammation. So I'm not denying that they experience some of those fasting mimicking benefits. I just don't think that's a good long-term health promoting strategy. And I do shows. I just did Stephen Burnett's show, Diary of a CEO, and they have I got a lot of criticism. If you go and look at the criticism, there's like 1.5 million people that have viewed that so far, and there's thousands of comments. The biggest criticisms I noticed, because I read all the critical comments, were that I was out of touch with modern science about the importance of living on animal foods, and I'm still advocating, plant foods like they did in the 1980s or something. So, I understand there's a disagreement there, and I believe that I'm right and they're wrong, but we'll let time and science ultimately prove, who's correct or not.
But when it comes to fasting and carnivore, do you think that the fasting can help if somebody's eating a lot of animal foods?
I think that fasting helps anybody that has the consequences of a pro-inflammatory diet, including a high animal fat diet. but I don't think it's enough to make up for the long-term negative consequences of eating a diet that's excessively high in protein and fat. I think excess protein, particularly excess animal protein, is one of the major contributing factors to kidney disease, some forms of cancer and heart disease. I think it's a major problem. I think the problem is avoiding excess, not necessarily that we've got a protein deficiency for most people.
You've been doing this a long time. Has there been anything that's come up over the years that you've changed your mind on?
Yeah, there have been. I didn't really understand early on how powerful fasting was. I thought fasting was a useful tool to get people to eat well. That you go on the fast and then you can adopt a good diet. And it was a tool to leverage people to eat better. What I found out, though, is that in addition, and the importance of eating, exercise, and sleep, fasting itself has a very powerful influence, both physically and psychologically. And, I don't like to have to fast myself. I do it every year. I don't like it because you have to rest. You can't play basketball. There's a lot of things about fasting that are annoying, but it does have a profound effect about how you feel about yourself and the world around you. And so, I don't talk about that part of fasting very much, but I know for myself, I've never really been sick. I've been healthy, all my life. I started this when I was 16. I'm 66 now. So it wasn't overcoming illness for me, but it has had, I think, a profound effect on my health and happiness, even though I wasn't doing it to overcome illness.
What do you think are the biggest takeaways from our conversation that people should be aware of, so that if we could just summarize it in just a few minutes?
Health results from healthful living. Healthful living involves diet, sleep, and exercise. Fasting every day for 12 hours and maybe once in a while for a longer period of time may help as a facilitator. And stop taking crap from people. I believe stress is like Christmas. It's better to give than receive. So be generous.
And I think it's interesting that you bring up like the importance of these habits, because that kind of has been something that's been an overarching theme of our conversation over fasting. Not that fasting's not important, but like you've also overstated that you have to do these habits as well. You can't just fast your way out of a bad diet.
No, I completely agree with you. And if you have to make a choice, the choice is focus on diet, sleep, and exercise, because that's what is the life-sustaining long-term focus.
What do you think is the biggest thing that can help people manage their stress long term?
Pick people that are healthy, health promoting, and pleasant personalities. Try to kick people to the curb that are destructive to your success, and realize that sometimes nothing's better than a bad thing.
Spend time with people that bring the best out in you. Well, this has been an amazing conversation. If people want to learn more about you and your work, where's the best place to do that?
Well, go to our website at TrueNorthHealth.com. As I said, we offer a free a phone consult with me if you need to be pointed in the right direction. And also, you can read our book, Can Fasting Save Your Life? It's a really good book that'll tell you what you need to know, even if it's not what you always want to hear, about how to get and stay healthy.
Amazing. Well, thank you so much for coming on the podcast and educating my audience. It's a hot topic right now, and it has been. I was definitely curious. And so thank you so much for your time.
It's my pleasure. And if you're in our area, come by. Let me give you a tour of the campus.
Would love that. Well, thanks again for coming on the show.
Excellent.